I'm Dr. Matthew Richardson at the Animal Clinic, and today we're going to be talking about feline dentistry. So the first thing that we do when we're doing a dentistry, we're going to take full mouth x-rays of the cat, and we're going to take some photographs of what the teeth look like before as well as afterwards. The patient is under a full general anesthetic right now with a breathing tube in. The tube protects the airway and makes sure that any of the moisture during the dentistry does not go into the lungs, and also provides a combination of anesthetic, gas, and oxygen to breathe. This is an ultrasonic scaler, so it vibrates quite rapidly, and it's going to remove all of this tartar buildup that you see here. And then we'll also do hand scaling, but you can see it just removes it quite nicely. So we use the ultrasonic scaler to remove the majority of the tartar, and then we'll use the hand scaler. This one specifically can go underneath the gum line, so we can make sure that we're cleaning both above and below the gum line. And during this process, we're also trying to identify any teeth that have what are called a pocket, where you can sort of, where the gum tissue and bone aren't connected to the tooth where they should be. When you go to the dentist and they're cleaning your teeth and they measure, they do what's called charting. What they're doing is they're looking to see how far they can pass a probe in underneath the gum tissue along the surface of the tooth. And in cats, you should be able to do that about 2 millimeters along each surface of the tooth. And if you can go further than that, it's a sign of bone loss. And if there's a single small area where you can do it, that's called a pocket. If we find pockets, we measure them, and if they're more than about 5 millimeters deep, or if the tooth has lost more than half of the bone around the root, we recommend taking the tooth out, because we can clean it, but the bacteria just get back in there, and the disease process just continues. So then cats' teeth have some areas where they tend to accumulate tartar above the gum line. So on the cheek teeth, it's this pocket right here. We don't have any canines in this patient left anymore. They've come out because of previous disease. But if she did have her canines, they have a little groove on them that we have to go and clean the tartar out of as much as possible. She just has this lower canine. We'll have a look at the groove on the other side of that. One of the challenges that we have when we anesthetize especially the smaller patients, the cats and the small dogs, is that they're not moving at all. They're not using their muscles, and so they aren't generating any heat on their own, or they're generating very little heat, and so they can actually get quite cold. So we do a few things to try to keep their temperature up. This blue blanket underneath the patient is a warm water blanket, and then we put a number of towels on, and then Eric's started up this what's called a bear hugger, which blows warm air onto the patient, and it's all just to try and keep her at a normal body temperature. The anesthetic is safer, and they recover much faster from the anesthesia if they're at normal body temperature the whole time. And we're monitoring her temperature, heart rate, how well her blood is carrying oxygen, how much carbon dioxide she's breathing out, all in an effort to keep her anesthetic as safe as possible. Also measuring her blood pressure. With all of our surgeries, but dentistry especially, when we're doing a cleaning like this and we don't expect extractions, our goal for anesthesia is to have them just be asleep. So you may notice that this patient is reacting a little bit sometimes as we're cleaning, and that is fine. We just want to make sure that she stays asleep while we do the procedure, but we don't need her to be heavily asleep because we're not expecting to do anything painful to her while she's under. If we do have any extractions, we'll give her some local anesthetic beforehand, even though she's under a general. There are two reasons to do that. The first is that, as I mentioned, we want to keep her at as low a level of inhaled anesthetic as we can. And so if we block the areas before we do anything, then that allows us to keep her at a lower level of anesthetic because those nerves don't fire. And the other reason is that there's good evidence in human medicine that if you give a local block before you do something that you would expect to be painful, like extracting a tooth, then even after that local is worn off, the patient is going to be much more comfortable because those nerves didn't even start firing or fired much less, and so they're more comfortable afterwards, even without much pain medication. So cats generally have a normal number of teeth for a cat is 32. They have two big cheek teeth at the top, a little tooth in behind and a little tooth in front, and then a canine and 6 incisors. And on the lower jaw, they would typically have 3 large teeth along the side for chewing, the canine, and then 6 incisors in the middle. So you can see this girl's lost a number of them already. We're going to polish her teeth. The polish will remove any micro abrasions on the teeth. It also has a fluoride on it to help sort of protect the teeth. We can't give cats fluoridated toothpaste because they spit it out, so we can't use that on a daily basis. But when we're doing a dentistry, we're going to rinse all of this off, so we can do that. Come along here, we're going to polish. Do all sides of all teeth. Now we're going to check those pocket depths on this side, make sure there are no pockets we need to worry about. Then we'll review the x-rays, and if everything looks good on the x-rays, we can wake her up. Those all look fine. This incisor is a little bit wiggly. The lower ones often are, and so we don't really lose sleep over that. Those teeth all look fine. Give a little wipe out at the back of her mouth just to make sure there's no gunk there from the dentistry. And then we're going to wake her up.